Well, good afternoon, everyone. Thank you very much for coming. My name is Dr. Aryan Tavvakkoli. I'm a consultant physician in East Sussex, and I'm here today to speak to you about cancer and what you can do about it. I suspect that most, if not all of us, have in some way been affected by cancer, whether personally or through a loved one. I myself, my life has been turned inside out and upside down through the loss of my loved one through cancer. And it was actually that monumental event in my life that was the catalyst in changing the way, radically changing the way in which I now approach cancer as a doctor. So I'm looking forward to sharing some of the information with you today that I had to learn on that very steep learning curve that I took a couple of years ago. I'll start right from the outset to tell you that I'm not an oncologist, and the information you hear in this talk you won't hear in an oncologist's office. That's not because there isn't any evidence base for it, but for several reasons. The interventions that I'm going to speak about haven't made their way into the national protocols and guidelines that doctors use in order to decide what kind of treatment they give. So just bear that in mind. A little bit about me. I qualified back in '91 from St Bartholomew's Medical College, and then for the next 25 years I followed a very standard conventional course in hospital medicine. I became a consultant in the year 2000, and after that I diagnosed many people with cancer, mainly lung cancer. And I worked closely with my consultant oncologists and other physicians for whom I have the greatest respect. After 25 years of practicing in hospital medicine, I decided that actually I want to practice medicine in a more comprehensive, more integrative way. So I opened my own clinic, Quantum Clinic in East Sussex. I'm not anti-conventional medicine, I'm not anti-chemo, but I do think that there is a lot of information that isn't currently used within the conventional realm that could make a tremendous difference to the journey of people going through cancer. So I'm looking forward to sharing some of that with you today. I've had to cut out about a third of my slides from this talk because I only have about 40-45 minutes, but at least I'm hoping to share a lot of information with you. So just to mention the basic difference between functional medicine, which is the kind of medicine I practice now, and conventional medicine. So in conventional medicine, we generally treat symptoms when they arise. So a disease occurs, usually after many years of issues, and we give that disease a name and we treat the symptoms. So it could be asthma, it could be colitis, it could be cancer, it could be dementia, whatever. In functional medicine, what we do is we step back a few steps and we look at, well, what are the underlying root causes that cause this problem in the first place? What are the underlying root issues? And that's what we address. So we don't just address the symptoms. So when it comes to cancer, the way I view cancer now is that I don't see cancer as a disease. I see cancer as a symptom. The disease is what was happening in the body for the months to years to decades even before the cancer arose in the first place. The disease is the terrain in the body. Cancer is the symptom. That's how I view it now. And of course, when someone gets a diagnosis of cancer, which is pretty common nowadays, it's completely normal to feel all of these emotions. And of course, the first question that everybody asks is there a cure? And often there is. You know, in conventional medicine, often the standard conventional route will lead to a cure of the tumor, whether that's radiotherapy, chemotherapy, surgery, or a combination. But very often there isn't, and the cancer has advanced to such a degree that actually curative treatment can't be offered, and then a palliative route is followed. But of course, for most people, many, perhaps that's accepted, but for some people it's not. For a lot of people, they look for another route, they look for other options, other avenues, and that's also understandable. So I want to talk to you now about the work of a researcher and psychotherapist, Dr. Kelly Turner. She's not a medical doctor, she's a psychotherapist. She wrote a book called Radical Remission, and if you haven't read that book, I'd recommend it to you. what she did, she specializes in integrative oncology, and she noticed that a lot of the patients she was seeing were turning around their cancer diagnosis. They were getting better instead of getting worse. And she started asking these people questions, and she actually interviewed over 1,000 people with cancer that had now resolved despite a so-called terminal diagnosis. When I heard about this research, I was very happy, because to my knowledge, there's no doctor actually looking at this information and asking these questions, because there are over 1,000 published cases of cancer that is now resolved. It's called spontaneous remission. In conventional medicine, we call it spontaneous remission, not radical remission. But nobody actually asks, what did you do? Because advanced cancer doesn't just disappear by itself, you've got to do something. So what Kelly Turner did was she asked all these people this question, what did you do? And interestingly, she found a lot of similarities. There were many similarities, but there were 9 similarities that all of these people had in common. There were 9 things that all of them did, and I'm going to tell you what they were. But first of all, I'm going to tell you what she defined as a radical remission. So there were 3 definitions of a radical remission. The first was that a person's cancer goes away without using any conventional medicine at all. The second definition was a cancer patient tries conventional medicine, the cancer doesn't go away, so then they revert to alternative methods which do lead to remission. And the third definition was a cancer patient uses both conventional medicine and alternative methods at the same time in order to outlive a statistically dire prognosis, which she defines as less than 25% chance of 5-year survival. So those were her definitions of radical remission. Now, before I go on to tell you what those 9 similarities were in all of these people who managed to turn around their cancer, just a quick word of caution, and that is that I would never advise that anybody follows just one route or one medicine or one supplement, because some people do that. For some people it works, but my opinion is that cancer is very complicated. It requires a very comprehensive approach, looking at many different factors. So just that word of warning, and I wouldn't suggest that anyone tries this by themselves, and I would always suggest that you are under the guidance of an experienced clinician through the journey. So anyway, let's look at these 9 steps. And the first thing that they all did was they radically changed their diet. So specifically, they either reduced significantly or they completely removed from their diet sugar, meat, dairy, and refined foods. And at the same time, they increased certain things in their diet. So they all increased fruits and vegetables, organic foods, and filtered water. So that was one of the major changes that all of them had in similarity. Second thing is they took control of their health. So it's interesting that the word patient comes from the Latin word pati, which means to surrender, to submit. And that's the last thing that these people did. They weren't the surrendering kind. So they received a dire prognosis, terminal prognosis, but they sought answers elsewhere. They looked for other avenues, they explored, they researched, they read. So they took things into their own hands. They didn't just accept a dire prognosis. They followed their intuition. I'll let you read that quote. So radical remission survivors, they always referred to their inner wisdom, to their inner voice, whenever they were given a path, a treatment path, to see if that worked for them, if that was suitable for them. They all used herbs and supplements in some form. Now, this is a minefield, really. There are thousands, probably hundreds of thousands of supplements out there. They're not all safe, they're not all effective. But in some way, people who were taking charge of their own health use some form of herbs and supplements, either for detoxification or to improve their immune system. We'll come back to this. Very important, they released suppressed emotions. So suppressed emotions are anything that we carry from the past. They're usually negative emotions, usually things like anger, regret, bitterness, fear. So radical remission survivors, they knew how important it was for them to really get down to those deep emotional issues and to find a way to release them, whether it was through neurolinguistic programming, whether it was through positive psychotherapy, through art therapy, through movement, whatever. But they access their emotional issues and they address them. And at the same time of doing that, they increased their positive emotions. Now, all of these emotions, joy, love, gratitude, you might think they're just emotions, but they actually have a physiological impact on the body. It's been shown scientifically that when we feel these emotions, we actually impact our hormone release. We impact the release of cortisol, our stress hormone, the release of DHEA, which is a well-being hormone. We affect our immune system. We affect what's called our heart rate variability. This is an independent prognostic factor in many chronic diseases. We impact our physiology through our emotions. That's been scientifically shown. And of course, cortisol and stress, we now know the mechanism by which the cortisol hormone actually increases the spread of cancer cells. So there's a direct link there very strong link between stress and cancer. So yeah, radical remission survivors knew the importance of dealing with stress and increasing their positive emotions. They all embrace social support. Now, for some people it's enough to have a supportive family. Other people need a bit more in terms of maybe community support or joining a group. But in some way, they didn't allow themselves to become isolated. They, in some way, joined with others and embraced some support. They all deepened their spiritual connection. So that could be in any way. And it doesn't mean one has to believe in a God, but in some way they linked with whatever you want to call it, the soul, universal flow, higher power, whatever. But they made that connection, and that was very important for the recovery of these people. And then finally, they had strong reasons for living. So whether it was, I want to stay around for my children, my grandchildren, or there's a project that I want to finish, or whatever, there was a strong reason for them to want to stick around. Something important I want to tell you about these 9 interventions. 7 of them are related to mental, emotional issues. 7 out of 9. Only 2 of them were physical. Supplements and diet. I think that's really interesting. I think it's very important as well. So again, we'll come back to that. Now, in my normal long talk, I would go through the scientific reasons why each and every one of those interventions has been shown to have an impact on prognosis. And there is published data on all of those interventions. I don't have time to go through all of them, but I'm just going to choose a couple of them and present that to you now. So first of all, if we look at diet, we know now, and it's in international guidelines as well, cancer guidelines, that definitely red meat and meat consumption should be reduced because there is a connection there between meat and saturated fat consumption and the development of cancer. But what I want to show you is the mechanisms, because we also know the mechanisms through which meat can lead to cancer formation. And the first is through heterocyclic amines. These are chemical compounds that are formed during the heating of animal protein. So that could be anything. It could be red meat, it could be chicken, it could be fish, eggs, dairy, cheese on pizzas, whatever. So heterocyclic amines are known to be carcinogenic compounds. So that's one potential mechanism through how cancer is formed through meat consumption. The second mechanism is through nitrous compounds. Again, these are carcinogenic compounds, usually through processed meat. And again, in the Western diet, often the food hangs around in our colon for hours, possibly days, because constipation is so common, and that's where all the carcinogenic compounds build up and lead to the increased development of colon cancer. And thirdly, interestingly, heme iron. So the iron that we get from meat and animal products is obviously different to the iron that we get from plant foods. And previously, it was taught, well, iron from animal foods is better for us because it's more bioavailable. It's better absorbed by the body. That there is some truth in that, but the problem is recently there have been a plethora of studies coming out linking heme iron from animal protein to certain chronic diseases. So Alzheimer's, type 2 diabetes, cardiovascular disease, these have all been linked to heme iron. And there is then now a potential link between heme iron and cancer. It's a very oxidizing element. Okay, so those are the possible mechanisms for cancer in meat. So when I advise my own patients with cancer in terms of their nutrition, I would never suggest that they have something that has the potential to form more cancer, because that's the last thing they need. So in terms of protein, I always advise a safe form of protein, and that means any kind of beans, and there is a plethora, many kinds of beans that one can have, and they give you your antioxidants and your fiber and your vitamins and minerals and your protein. So a lot of things that meat doesn't give you. And also, of course, it's important to have some saturated fats, healthy sources of saturated fats like avocados, nuts and seeds. And essential fatty acids are also really important, so the omega-3s. And where I advise my patients to get those is from the purest source. The purest source is marine algae. So everyone thinks fish make omega-3. Some of them do, but most fish don't make omega-3. Most fish obtain their omega-3 by eating marine algae. So that's where they get their omega-3, and then they concentrate it in their flesh. So it's true that fish do have a high amount of omega-3 in their flesh, but that's not the only thing they have in their flesh, because they also concentrate traces of mercury and arsenic and dioxin and pesticides. Our oceans are toxic. There's no way around that. So the purest form of getting marine algae is from the bottom of the food chain, and that's, the purest way of getting omega-3s is through marine algae. And you can get those in supplements. You just look for supplements, marine algae. Water, of course, essential. It's been shown in studies to reduce different cancers, including colorectal and breast and prostate. So water consumption is important. And greens have been shown in so many studies, in laboratory studies, to inhibit cancer cell lines. So prostate, gastrointestinal, ovarian, breast, and it's the carotenoids in the greens. So whether you're talking about Swiss chard or kale or any kind of deep dark green leafy vegetable. And the best way of getting those, the way I advise my patients, is in smoothies or juices. That way you get a concentration of greens, all those carotenoids and flavonoids and all the phytochemicals that fight cancer. The easiest way, because if you think of it, if you have a plate full of colourful vegetables and fruits, it's quite difficult to eat that. When you blend it into a fluid, it's much easier, and it's digested better, and it is absorbed better by all your cells. So taking control of your own health. I just wanted to tell you about that bottom study there, because that was really interesting. This was a group of people with stage 4 cancer, so very advanced cancer, and they were followed up for a year, I think, and they were given weekly sessions of psychotherapy, and then their survival was recorded. So how long they survived, basically. What they found was the people who survived the longest were the ones who exhibited those characteristics. So they had the ability to act and to change. They had the willingness to change, whatever that was, their lifestyle, their mental attitude. They worked to have relationships with others. They didn't remain socially isolated. So, and they worked to help themselves, self-help mechanisms. So these were the characteristics of those who survived the longest. And I tell you that study because it's very interesting. It shows that your personal characteristics and your decision to take charge and to change your lifestyle does actually impact on the prognosis, according to this study. And then when we talk about herbs and supplements, again, like I said before, this is a real minefield, but most people take herbs and supplements either for their detoxification actions. So, you know, in this world we're exposed to so many things through the diet, pesticides and herbicides and glyphosate and goodness knows what else. They can take them for their strengthening action, for the immune support, but some herbs do actually have anti-cancer effects as well. So I just want to ask if anyone here has heard about citrus pectin or modified citrus pectin having anti-cancer effects. Nobody? Okay. It's interesting because citrus pectin has been extensively studied, laboratory studies, not clinical studies, and published. There's published research showing about its effectiveness in preventing cancer cell spread. metastasis. It kind of prevents the stickiness of cancer cells from sticking together. And it's been shown to inhibit the growth of cancer cell lines in the laboratory, gastrointestinal cancer, prostate cancer, ovarian cancer as well, and a number of other cancer cell lines. Now, you don't hear about citrospectin. Why don't you hear about citrospectin and numerous other herbs and supplements that have been extensively studied in laboratories? The reason you don't hear about them is because whenever a medicine or a supplement or whatever therapeutic agent ends up on the market, it needs to go through years and years and years of clinical research before it even gets to that stage. So it starts with laboratory research, and then unfortunately usually there's animal studies, and then it goes on to small scale human studies, and then large scale randomized controlled trials. They go through years of processing in order to even get there. So whilst there is a strong basis for laboratory results in laboratory testing, these agents haven't yet found their way into the large-scale clinical results testing. And they may never do. They may never do, because you need an organization with a lot of money and a lot of interest to actually take it that far. So we may never find that citrospectin will become a potential treatment for late-stage cancer, even though there is very strong evidence on laboratory trials that it inhibits cancer cell lines. Melatonin, who's heard of that as an anti-cancer agent? One lady, two, okay, great, three. So melatonin, most people know that it's our sleep hormone. It's the hormone that keeps us asleep, but it's also strongly anti-inflammatory. It's antioxidant, it regulates estrogen levels, and it has potent anti-cancer properties. Now, the IARC, which is the International Agency for Research on Cancer, have done some studies on people with sleep issues. So they've particularly looked at people who do shift work. So there's a disruption in the circadian rhythm. And they found that unfortunately people who do shift work and have disrupted circadian rhythm have an increased risk of cancer. They get more cancer. So night shift working in men, those men had an increased risk of prostate, lung, bowel and bladder cancer. So much so that this sleep disruption has been classified as a 2A carcinogen. A 2A carcinogen means a probable carcinogen. So just the fact that our sleep is disrupted through shift working, that in itself increases the risk of cancer. So when we look at melatonin, which with all those actions that I explained before, there's actually been a meta-analysis on melatonin. A meta-analysis is when lots of studies are pulled together and their results are pulled together. So it's one of the strongest bases of evidence. And in this meta-analysis from 2015, they found that the studies unanimously found melatonin increases the mean survival time and reduces the toxic effects from chemotherapy, and it significantly improves complete and partial remission, as well as the 1-year survival rate by around 50%. 1-year survival rate by 50%, that is huge. That's huge. How come we're not hearing about melatonin? Do you see? And the only reason I can think of is that there haven't been formal safety studies on melatonin. Even though, to my knowledge, there hasn't been a single, serious side effect of melatonin, but because those studies haven't been published, therefore these aren't coming out in the national protocols and the national guidelines. And it's the national guidelines that your oncologists will be following, even though there is firm evidence that melatonin increased survival by 50%. So, that's just a couple of supplements I've mentioned to you. There are numerous ones that have been extensively studied in laboratories, have even gone on to meta-analyses, but they're not in our national guidelines and policies for various reasons. And most doctors who are trained in specializing cancer oncologists may not even be fully aware of these. So because of time, I'm not going to be able to go through all of those 9 reasons and all of the research available for them, but there is, as I said to you before, there's plenty of data. I want to move on to what I call the 4 pillars of health, and because this is relevant to cancer as well. And the first pillar which I call the foundation, is looking after our mental and emotional health. I really can't stress how important this is, because treating cancer, treating any chronic condition, and especially cancer, really we've got to deal with the emotional issues first. We've got to, because stress, cortisol, all of these stress hormones, they promote the development of chronic disease, and they're inflammatory. And they increase the spread of cancer. It's been shown again in laboratory studies how cortisol increases the spread of cancer. So dealing with those emotional issues is really key and paramount. For me, it's number one before moving on to the physical interventions. Nutrition is pillar two. It's looking after the structure of our body, the framework. In my practice and with my cancer patients, I always advise a whole food, plant-based diet, rich in phytonutrients, rich in fiber, low in saturated fat, high in greens, high in fruits and vegetables. So these are the cancer-fighting agents. Plenty of herbs. Herbs have a special acid in them, ursodeoxycholic acid. So anything, basil, tarragon, coriander, all of these cancer-fighting foods. Seeds such as black cumin seeds, celery seeds, these attack the stem cells in cancer. These are all potent agents in treating cancer. And then pillar three is what I call the reinforcements. It's supplementing our diet. I used to be of the opinion that our food can give us all the vitamins and minerals that we need. I've now changed that opinion because I test all of my patients. I do comprehensive nutritional testing, and 100% of them will show up deficiencies, 100%. Magnesium is one of the most common. Zinc is another really common one. Iodine is another really common one, but there's other nutritional deficiencies, and it varies from person to person. Even the person with the healthiest diet. And the reason that is because of our soils. It's because we have depleted our soils through years and years of agricultural use and chemicals, and the minerals are just no longer there to be pulled up by the vegetables and the greens. So we're not getting the iodine in the vegetables, we're not getting the magnesium there. It's because of the soils. So I think that supplements are really important. There are certain supplements that I would advise for everyone. Those are B12 and vitamin D, because they are, I think that they're essential. And then in terms of other supplements, personally I prefer to do laboratory testing and then see what's actually deficient before advising, because everyone, as I say, is different. And then pillar four, ventilation, what I call ventilation, is movement and exercise. So important. Whatever it is, whatever you can manage, whatever you can do. Movement is one of the best ways for detoxification. It improves our ventilation, our lung capacity, it moves our lymph, it moves our circulation. It's one of the best forms of detoxification. And actually, interestingly, after Kelly Turner published this book, she continued to, for those who haven't seen it properly, she continued to interview people who had recovered from cancer after a terminal diagnosis, and she found a number of other similarities, and one of them was exercise. So that was the number 10 similarity. So hopefully we'll be moving away from something like that and more to this representing our health. So a stable foundation, mental and emotional, good support structure, that's our nutrition, lots of reinforcements, that's the supplements filling in the gaps where the nutrition is failing, and plenty of ventilation, so that's movement and exercise. Just want to mention something else that's often missed in the approach to treating chronic disease and especially cancer, and that's how vital blood flow is. Now, whenever we give intravenous treatments, let's say intravenous chemotherapy or whatever that's intravenous, it's a really good way of getting those medicines into our veins, into our blood vessels. But if we don't have really good blood flow to all those tiny cells and tissues in the peripheries or very deep-seated tumours, if there isn't good circulation there, then it's not going to get from the big blood vessels to those tiny capillaries, because the circulation isn't there. So you just have this high concentration of whatever therapeutic agent floating around in the blood, but it's not getting into where we want it to get into. And that's one of the theories why pancreatic cancer is so difficult. It has one of the poorest prognoses. One of the theories for why that is because it has such a poor circulation. the blood flow around it there's a lack of blood vessels, and therefore chemotherapy just isn't getting there. So, blood flow is really important, and it's particularly the microcirculation. So the microcirculation is those tiny capillaries, the network of capillaries that supply our cells. And if you were to put all of those end to end, it would be around 60,000 miles long. So you can appreciate how vast this expansive capillary network is. So this is the place where oxygen is delivered to your cells, where nutrients are delivered to your cells, where the toxic products from your cells are taken away. It's the microcirculation. So it's really essential. Now, is there a way of improving the microcirculation? To my knowledge, there is. This is one of the best ways that I've found, and it's called BEMA physical vascular therapy. I use it in my clinic for my patients. And what this does is it gives out thousands of tiny electromagnetic signals to the body, and when they hit the blood vessels, it causes them to constrict. It's called vasomotion, and it increases the blood flow through those blood vessels. So NASA uses this for their astronauts to improve the circulation, and it's really not used very much in the UK, astoundingly. I'm very surprised, but anyway, it's a really effective way. And I'm just going to show you a little video. It's been shown that if BEMA is used for 8 minutes, it increases the microcirculation for 12 hours. So on this video, you're going to see a blood vessel. There'll be four blood vessels, and the one on the left is before BEMA therapy, and then the one on the right is after 8 minutes of BEMA therapy. Just have a look at the blood circulation and compare the two. So you see the major difference there. So so I use this to increase the microcirculation and get those phytonutrients and whatever else I'm giving into where we need it to get to. There's another way of improving circulation and microcirculation. It's called exercise with oxygen therapy. I'm sure you've all heard of hyperbaric oxygen therapy, which improves the oxygen delivery to the cells and tissues, and it's been shown to improve conditions like multiple sclerosis and various other conditions. Exercise with oxygen therapy is a slightly more practical way of delivering this similar thing. So you've got the white device on the floor is called an oxygen concentrator, so that sucks in the surrounding air and it creates 100% oxygen, and then that is pumped into that massive reservoir, so that's full of 100% oxygen, and then the patient exercises in some way, whether it's on an exercise bike or whatever, a rebounder, and they're breathing in 100% oxygen from that reservoir. And it's been found that it's fairly similar in its effects to hyperbaric oxygen therapy. So this again is an excellent way to improve the microcirculation. Again, it's not in it's used in America in quite a few places, but not so much in Britain. So I just want to tell you briefly about the cancer program integrative cancer program that I run. You understand that no one who is not an oncologist, people who are not an oncologist cannot claim to treat cancer in the UK. So that's the way it is. So I have an integrative cancer program. I can't claim that it's a treatment because I can't do that legally. But in my cancer program, what I do now is I look at what are the potential underlying causes that created that in the first place. So micronutrient deficiencies, well published, well studied, well-known cause of cancer. But how many times is our nutritional analysis performed when there's a diagnosis of cancer? Might get an analysis of B12 and vitamin D, but not much else. The nutritional analysis I do gives me a 14-page handout, completely comprehensive of everything that's going on. Vitamins, minerals, essential fatty acids, proteins, amino acids, you name it. So we know exactly what's going on with that person's nutrition that needs to be addressed. We'll look at chronic infections. There hasn't been time to address those, but a number of viruses have been implicated in different cancers. So Epstein-Barr virus, cytomegalovirus, herpes viruses, these have all been documented causes of certain cancers. So again, we look at whether that might be a possible factor. Exposure to toxins, chemicals, heavy metals, nicotine and asbestos everyone knows about, but usually we don't ask about heavy metals such as mercury exposure, etc. These are all important, and we're exposed to these in the environment all the time, some people much more than others, and they can be implicated in various chronic diseases as well as cancer. Electromagnetic radiation, another important factor, and of course stress in all its forms. So it's very much a multifaceted approach. I think it's very important to approach cancer in a comprehensive way, not just in a unilateral way. And it's addressing the underlying factors, and it's very much looking at inflammation and removing as much as possible anything that's causing inflammation in the body. So initially, in the first consultation, I would take a very detailed history, looking at all those potential underlying factors. The first consultation, I would give nutritional advice right there from the start, address the underlying issues, and give a first supply of supplements. I use a number of nutritional supplements, and some of them are known to have anti-cancer effects. And then it's a matter of functional medicine laboratory tests. Now, these are very comprehensive, detailed tests that are not available on the NHS. So it's looking very much at nutritional analysis. I look at the microbiome, which is really important. There's now thousands of studies in peer-reviewed journals on the importance of the gut microbiome in the development of chronic diseases. So again, no time to talk about that. If you just Google gut microbiome and cancer, you'll see how important it is. And a number of other testing. And then it's a matter of coming up with some factors are individualized for the particular patient, and some things I give to everyone. So, and the plan will involve addressing the emotional issues, definitely healthy nutrition, that's paramount, targeted nutritional supplements depending on what's shown up on the testing, because everyone is different, detoxification plan, and also some anti-cancer supplements. And then I deliver those, or make sure that they enter the cells and the tissues through increasing the microcirculation, through exercise with oxygen therapy, BEMA physical vascular therapy, and also low-level laser therapy. It's also called photobiomodulation. So some of you may have heard of this. It's often used in physiotherapy clinics for joint issues or arthritis. Well, I use it for its effects on systemic inflammation. Laser is amazing. It's not the cutting laser, not the cutting laser, but it's called cold laser or low-level laser therapy. It has anti-inflammatory effects. It increases circulation. It increases white cell production, and acts directly on the mitochondrial level. So the rays of light go straight to the mitochondria and increase ATP production, which is the energy source of the cells. So I've really cut that talk down because it's usually much longer, but because of the time constraints. So I want to finish off by telling you the 10 things that one can do today to increase the likelihood of overcoming cancer, and it's based on the research of Dr. Kelly Turner, who wrote the book Radical Remission. So number 1, change the diet. So take out meat, dairy, sugar and refined foods, increase vegetables, fruits, organic produce, filtered water. Number 2, take control of your health. Don't just accept it when someone gives you a dire prognosis. Research, read, ask, question, see what other people have done. There are thousands of people who have overcome so-called terminal cancer. One of the wonderful ladies that I work with, it's called Jem Ayres, she was diagnosed with, she's not a patient of mine, which is why I can speak about her. She's a colleague, and I refer my patients to her. She was diagnosed with malignant melanoma a few years ago, and she had metastases to her brain, to her lymph nodes, and to her lung. She had surgery for the brain metastasis and then was given palliative treatment for the rest and sent home. Hospice team was sent to her, palliative care team, everyone. She sent everyone away, and she decided she's going to do this herself because all that was offered to her was palliative care. That wasn't good enough for her. So she definitely took control of her health. She did all of these things and more, and she's now completely cancer-free. And now she sees people with advanced cancer, and she tells them what she did, and I refer my patients to her because she really addresses the emotional side of things. So the emotional issues are so important, and she's really good at doing that. Follow your intuition, so listen to your inner voice to consider if what you're doing feels right for you. Use safe herbs and supplements. Now, this is a whole talk in itself. I would always advise, because I'm always asked, where do you get your supplements from? And there isn't like one company that I go to. There's lots of different ones, and it takes hours and weeks and months of research. But I would always advise that you work with someone who knows what they're doing. So work with someone who's a professional and who can advise you on safe and effective supplements. Most of the supplements on the shelves are probably at best not effective and at worst harmful. Not most, some. And you don't really know. When you work with a professional, then they've researched it properly for you. Just to give one example, curcumin, which is another very effective, potent anti-cancer spice, curcumin from turmeric. There are maybe hundreds of curcumin products out there on the shelves, and a lot of them are not effective because curcumin doesn't get absorbed. You know, it just stays in the gut. It's very poorly absorbed into the body. If you take it by itself, it's just going to stay in the gut. It's not going to get into your other cells. So it's very good for gut inflammation, but it's not any good for other places. In order to get it absorbed, you need to take it in special formulations. So black pepper helps its absorption. And also if you take it in special forms like liposomal or a lipid formulation, so it's a fatty kind of form. So the kind of curcumin I use in the clinic has been studied. Again, there's been lots of studies, published studies in peer-reviewed journals, and it's been shown to have great bioavailability. It even crosses the blood-brain barrier. Not all curcumin products will do this, you see. So unless you're working with someone who knows and who's researched these things, you might end up buying something that you're spending a lot of money on and isn't actually doing much. So just when you're using herbs and supplements, just what I would advise is work with someone who...
you know, say about vitamin D and then B12 supplements. They're obviously available in all supermarkets. Are they supermarket versions of those considered different?
Yeah, it's difficult to give kind of a blanket statement. I would always say read the label. If you see, generally speaking, I would say avoid those that have a lot of fillers, a lot of kind of additives. Try and go for the purest forms. Obviously go for the plant-based forms. Vitamin D3 can come from lichen, so you can get it from lichen as opposed to lanolin or sheep. So it's such a broad topic, it's difficult to give a blanket statement, but generally speaking, I would say avoid as much as you can supplements that have a lot of additives in them. Yeah.
Turmeric. Do you take turmeric yourself?
I do.
You do. I used to take turmeric, and I was finding that it was coming out in my way a lot more, so it was very colourful. It's going to be anyway, but I found that I got it from a company called Anagic. And they do a Yukon, which is grown in ionised alkaline water.
Okay.
I was wondering what you thought about ionised alkaline water.
Okay, I'm not familiar with that particular product, so I can't comment on that. The one I use, I tend to prefer to use products that have been analysed and have been studied, and so the one I use I know works because there's been studies and they've looked at inflammatory markers and they've looked at bioavailability, so I know it works. Maybe that one does too, but I can't comment.
So they've been using it for the last 60 years.
Okay.
Highly researched, but I just wondered
if it works for you, that's great. No, I haven't heard of it. No. Thank you for mentioning. I'll look into it. So going on with the things to increase the likelihood of overcoming cancer, releasing suppressed emotions, really important. So again, psychotherapy, emotion code, neuro-linguistic programming, all of these options. Increasing positive emotions. I always say to my patients, start the day with a prayer of gratitude or statements of gratitude. That's really powerful. Positive psychotherapy, art therapy. Heart math, if you haven't heard of it, is a really good technique. You can Google it or look on YouTube. It's a very simple technique to improve the heart rate variability. This is a physiological measure that you impact on by increasing your positive emotions, and it improves the prognosis. Again, widely researched, studied. Heart math, that's worth looking into. Embrace social support. Cuddle a pet, cuddle a human, join a support group. talk with friends and family. Don't be socially isolated. Deepen your spiritual connection, whether that's through meditation, mindfulness, yoga, tai chi, anything that suits you. Find and connect with your personal calling. Why do you want to stay? Is it you want to stick around for your kids, your grandchildren, you've got a project you want to finish? Find it, and having that will to stay is really important. And finally, moving yourself daily, so some form of exercise is really, again, beneficial. These are the steps that the 1,000 people that Dr. Kelly Turner interviewed who overcame a diagnosis of terminal cancer. They're the steps that all of them took, plus a lot of other things, but these were the similarities between all of them. Once again, I would advise that you don't go with one thing, one supplement, one approach. I think cancer should be approached in a very comprehensive, very multifaceted way. It's a complicated issue. It can advance aggressively. I would always advise that you work with a professional who knows what they're doing. And that's great. That's 45 minutes. Wow, I've kept to my time. So I think there's a few minutes left for questions, but before we do that, if anyone thinks that you would like to see me for a consultation or to discuss a possible consultation, please let Kian know. Kian, can you put your hand up at the back? And if you give her details to Kian, your details, I will call you shortly and then we can talk about your needs. So thank you very much for listening to me. Thank you. Thank you. I think we have a few minutes for questions, if anyone has any questions. Yes?
We're talking about how electromagnetic fields are so important, right? So for example, right now in our good homes now, we have Wi-Fi devices, so many different Wi-Fi devices. Now I know that Wi-Fi, say maybe one of them doesn't necessarily have an impact on you, but say you have 5 all on at the same time, right? I don't know, like, how's that affecting us? Like, I have questions about that, you know, like, and also Bluetooth, people walking around with these Bluetooth headsets, you know, it's been shown like, that particular hemisphere has a whatever increased, you know, chances of getting whatever type of cancer and so on. So I just want to know some of your thoughts about that. What we can do.
Sure, that's a really good question. So electromagnetic fields, there is a medical condition called electromagnetic hypersensitivity, but it's not recognised in the UK. It's only recognised in a European country, and I forget which one, it might be Belgium. It's recognised as a medical diagnosis. So in people who are sensitive to electromagnetic fields, it causes a lot of symptoms. It can cause anxiety, it can cause increased heart rate, depression, various physical manifestations.
Keep the phone on the body, sorry, just like...
Absolutely, we should never keep the mobile phone in a coat pocket because it increases the risk of breast cancer, and we shouldn't sleep with anything charging close to our heads, because when we charge a mobile device or a laptop, it quadruples the electromagnetic field. So if you didn't know that, the electromagnetic field coming off this, if I were to charge it right now, it would reach 4 times the distance. So definitely don't charge anything in your bedroom. Don't go to sleep with a mobile phone or any charging device close to you. Yes, there have been studies. I can't call to mind the details, but I know that there are studies linking electromagnetic fields to certain cancers. Yeah, thank you for bringing that up. Yes?
Does anyone want to get in nutritional testing done if you haven't got cancer?
Yes, absolutely. So,
To know what, you know, I've had a small one before, but a bigger one.
yeah, so you can see any health practitioner, usually in functional medicine. So the test that I use is called Nutraval, and most functional medicine physicians will use some sort of nutritional assessment. A lot of them use Nutraval. You don't have to have cancer to have that. Anyone can have. A lot of my patients don't have cancer, but I do the nutritional testing on them. It's really useful. Always shows up things. Yeah. Any other questions? Hello.
Can you recommend someone regards when animals got cancer, cat companions, animal companions?
When animals have cancer, gosh.
Humans
Yeah.
cancer, but
Yeah.
one of my animal companions got cancer. And,
Right.
So because the approach is a bit different for animals, isn't it?
I'm sure, I don't know. I don't know anything about treating animals. I don't know an individual, but I know an excellent documentary that you can look at, and I've forgotten the name. There was The Truth About Cancer, which is a documentary, but there was one about pets. I think it was The Truth About Pet Cancer or something, and that would have a minefield of information. Just if you Google The Truth About Cancer, there will be a documentary made by the same people, and it's about pet cancer. And so that would have a lot of information, but I'm not aware of any individuals dealing with that.
Thank you.
You're welcome. Hi.
Furthering on the ionised alkaline water I was on about, just so you can look at yourself, because I do want context, because my brother's got Hodgkin's lymphoma. He started a vegan diet, he was doing really well. I actually bought one of their ionised alkalising machines, because they've used it as a treatment for adults for the past 40 years for most illnesses, £100 out an hour.
Yeah.
And it ionises the water and hydroxylates it. So
Okay.
there's more hydrogen present. More oxygen present.
Yep.
Splits the atom. It actually absorbs 30% faster than any water on the planet.
Okay.
It is also at 9.5 pH. So obviously you wean yourself from 7 onwards.
Yep.
And that's a magic. And I just wanted you to
Okay. Yeah. Thank you.
because it is fantastic. It is helped my brother's health with Hodgkin's lymphoma. It's helped my friend Samantha who's got Lyme's disease.
Okay.
And it's helped my health and up here, sensibly. But I think with your water, it's just as important as your food, like you say.
Absolutely. Yeah.
A tap in this country whatsoever, because last time it was tested in Birmingham it was at 6.1 pH, which is ridiculous.
Very acidic. Yeah. Thank you for that.
Bottled water, I don't touch it.
Sure. Okay. Yeah, thank you very much. You mentioned about hydrogen. Molecular hydrogen is another very anti-inflammatory agent, and that's again one of the things that I use, molecular hydrogen tablets, and you just pop it in water that you drink. That's very anti-inflammatory, and I use that again as a treatment. Thank you for mentioning that. Yes?
Can I just ask about turmeric again?
Yeah.
If you had it in a fresh form, would that give you enough of the cocaine?
So it's great to have fresh organic turmeric, of course, in cooking, and the more you have the better. But when you're talking about, if someone's already developed a chronic disease and something like cancer, then you really need to be looking at high doses, clinically effective doses. So the amount that we have in cooking is fine for maintaining general health and immune support, but it's not really the doses that we need when you're talking about cancer or chronic disease. So absolutely use fresh organic turmeric in cooking, but when you're talking about cancer, you need clinically effective doses. Yeah. Hi.
In terms of charities that are specific to cancer research, I've not looked on those websites myself. Is it fair to say that the information you gave us today, this afternoon, was very informative, doesn't feature strongly, i.e. a whole food plant-based diet is accentuated or highlighted on those websites? So my question, I suppose, is this information, it's known, it's research, it's out there, you practice it, but it seems to me there's a kind of general lack of it, not in the public domain, and I wonder why you thought that was.
Yeah, that's a very good question. So all of the cancer guidelines that you look at, the British, the American, they will all say for people with cancer, have a mainly plant-based diet. They say that is in the national guidelines, mainly plant-based diet. And they say reduce red meat, and so they don't say whole food plant-based 100%, but it is kind of mainly plant-based. Why isn't it out there in terms of the fact that animal protein is actually carcinogenic? Well, I think you can guess the reasons for that. You're dealing with an industry with, trillions of pounds, a lot of advertising, where it's ingrained in us since we're born until adulthood, the importance of dairy and meat. It's a culture, and it's something that it can be difficult to overcome. But the science, the data, when you look at the studies and when you look at long-term population data, the populations who do best in terms of reduced risk of Alzheimer's, of cancer, of cardiovascular disease, they're the ones on whole food plant-based diets. That's what the science is telling us. It will come out, it's just taking its time. Yeah. Maybe one more question, yes?
Somebody who's following a chemotherapy program for stage 4,
person's been told not to have anything anti-inflammatory like turmeric, for example, and a whole load of other things, because it will fight against the chemo that they're being given. So does that mean you have to wait till the programme ends before they can start having, a healthier diet, basically, more anti-inflammatory?
So again, it's difficult to give a blanket answer because there are different chemotherapeutic agents and different cancers. So with the patients that I see, I look at what they're taking, and then if I need to speak to the oncologist, that happens as well. But to give a blanket answer that nobody should have any anti-inflammatories because they're on chemo just does not make sense, because our diet should be anti-inflammatory. The whole point is to reduce inflammation in the body. I can understand that the fear is that some supplements may interact with some chemotherapeutic agents. That's fair enough, but that's assessed on a case-by-case basis. It's not, there's no blanket rule. So I would look at each one individually. Which drugs are they on? Which supplements may or may not interact? Most of the time there is not an issue. It's just a fear of a potential interaction. I think I've run out of time. Thank you so much. Thank you. I'm going to be around if anyone has any other questions.